reading a research paper together. The title of this paper is Remote Ischemic Preconditioning Can Protect the Heart and Even Promote Blood Vessel Regeneration. Hello, everyone. Today, I want to talk about a topic that sounds very technical, but is actually closely related to our heart health. Have you heard of remote ischemic preconditioning, RIC? Researchers have found that it might protect the heart and even help blood vessels regenerate. Today, we'll explain this study in a simple way so everyone can understand it quickly. What is remote ischemic preconditioning, RIC? Imagine tying a blood pressure cuff on your arm and inflating it to over 200 millimeters of mercury, temporarily cutting off blood flow to your arm for 5 minutes, then releasing it and repeating this 3 times. This process is called RIC. If you do this once a day for a week, it's called chronic RIC. In simple terms, it means briefly blocking blood flow in the arm to stimulate the body, making the heart more resistant when it faces real ischemia or injury. Why study this? During a heart attack or myocardial infarction, the heart is injured due to ischemia and reperfusion. Previous studies have shown that RIC can reduce the extent of heart damage. However, large clinical trials have had inconsistent results, with some patients not benefiting. Possible reasons include factors like age, diseases such as diabetes and hypertension, and medications like blood pressure drugs and anesthetics. Therefore, scientists wanted to see if doing RIC daily, chronic RIC, might be more effective. How was the study conducted? The study recruited 11 healthy young volunteers. Blood samples were taken at 3 time points. Before doing RIC, control group. After 1 session of RIC. After doing daily RIC for 1 week, chronic RIC. Researchers analyzed cytokines in the plasma, such as IL-1-alpha, CXCL5, growth hormone, and others. Surface proteins on monocytes in the blood, Ti2, CCR2, were examined. Plasma was used to culture vascular cells to see if it could promote new blood vessel formation, a test known as the tube formation assay. Research results. Angiogenesis, new blood vessel formation. When vascular cells were cultured with plasma from chronic RIC, repeated ischemic conditioning, indicators of angiogenesis, such as nodes, branches, and segments, significantly increased. This suggests that plasma from chronic RIC truly has the ability to promote blood vessel regeneration. Cytokines. Overall, average levels showed no significant differences. However, some individual volunteers exhibited noticeable changes. For example, levels of IL-1-alpha, CXCL5, and growth hormone increased after RIC or chronic RIC. This indicates that the effects may vary between individuals. Monocyte surface proteins, Ti2, associated with angiogenesis, increased. CCR2, associated with inflammation, decreased. This suggests that RIC/chronic RIC may shift immune cells toward a repair rather than a destructive type. Significance of the study. RIC/chronic RIC may promote heart protection through a combination of factors in plasma and changes in immune cells. The effect cannot be replicated by a single hormone, such as IL-1-alpha or growth hormone, alone. It requires the combined action of multiple factors. Individual responses differ, indicating this is a personalized protective mechanism. Simple summary for everyone. What is RIC/chronic RIC? Temporarily restricting blood flow in the arm using a blood pressure cuff to stimulate the body. What does it do? Helps regenerate blood vessels and modulate immune cells, potentially protecting the heart. Why is it important? It could become a simple and inexpensive protective method for patients with heart disease or myocardial infarction. But be cautious. So far, this is only a small-scale study. More clinical trials are needed to confirm the findings. In short, this research suggests briefly blocking blood flow in the arm every day might make the heart more resilient and promote blood vessel regeneration. Although it sounds almost magical, science is gradually verifying these effects step by step. Does everyone understand this paper? Does everyone like it? Do you believe in the effectiveness of RIC? Would you like to try RIC and take care of your health? Hurry and scan the QR code to order an RIC sphygmomanometer. Remember to scan the QR code to place your order. Thank you all for watching. I am Dr. Andrew Shu Lee. See you next time.